So I actually have no slides. I'm going to try and be fairly brief here. I'd like to actually invite the industry panelists for dose up on stage. So, we have a whole day on dose tomorrow. But what I'd like to do right now is just give a brief, physician's perspective on, all these new regulations, all these new rules, and all these new things that we need to do now with either monitoring or recording or reporting dose. What is it like for the radiologist? I currently work at a academic medical center at the University of Pennsylvania, and at UPenn, we've been recording dose for a while. We've been participating in the ACR dose index registry. We currently use an open source dose monitoring system, which actually was developed at the University of Pennsylvania by Tessa Cook, who's sitting down over there. But we also use a commercial solution as well. So we're overstaffed in terms of the amount of dose monitoring that we currently use. And I just want to get a perspective from the audience, really. How many folks currently use or participate in the ACR's dose index registry? Oh, good portion, almost half. And how many people also use some other solution, whether it being an open source solution or a commercial solution, also for evaluating dose? So a little bit less, maybe a quarter. And how many folks currently don't use any software for recording or managing dose? Yeah, a couple here and there. Anybody here from California? Nobody made it all the way over, since they're probably still at this point trying to manage all of their dose issues. So, I've spoken to a number of radiologists around the country to try and get an idea of what their perspectives are on these new regulations and new rules regarding dose. And there are obviously a number of negative reactions that I've gotten. There are folks who are concerned about overregulation. Too much. The government's trying to control what we do here in our department. There are some folks who believe that radiation is completely harmless, and that the more radiation the better, and people are overreacting to these things that they see on CNN or the New York Times or things like that. And obviously there are a number of folks who are concerned and believe that all this focus on CT radiation dose is harmful to our specialty, because it has been impacting their CT volumes overall, and obviously potentially affecting revenue. On the other side, I hear some other perspectives as well. One from one radiologist said that I never really paid attention to our doses, and reporting them really made me realize how high some of our doses actually were. And so they actually went back and made some major changes to their protocol. So I think this is the visibility argument, the fact that if you don't see it, if you don't pay attention to it, you don't know it's there, there's nothing really to change. Your images look fine, so why make any changes to your CT scan protocols? And the one that I really like was from one particular radiologist who said, I had to relearn a lot of my physics. But now, I feel much more comfortable talking to a referring physician or a patient about radiation dose. He said that, he used to get maybe 1 or 2 questions per year by a patient or referring physician about CT dose. And at that point, because, he never really paid attention to it, he didn't really know what to say. So he would refer him to the medical physicist, or he would tell them to look up something online or something like that. And that really isn't very good patient engagement. But now, because they have to do it on a regular basis, because they look at the doses, and he's paid attention much more to the physics behind all of this, they feel much more comfortable talking to the referring physicians, talking to their patients about dose. And I think that involvement, that engagement of the radiologist with referring physicians, and that engagement with the patient, I think is very important, not only for quality and patient safety, but also to the important for the future of our specialty. I think as radiologists, we've gotten very used to sitting in the reading room and just cranking through cases. Really having the patient be as invisible as possible, but I think, becoming more involved in protocoling, because now we realize that, do we really need this extra scan? Do we really need to cover this whole portion of the body when we scan this patient? I think this whole the whole concentration on dose and what it means to a patient has really allowed me as a radiologist to become more involved in the practice of radiology within my within the department, and it's allowed me to engage with our referring physicians and engage with our patients much more. So that's my perspective.